This presentation is about health and well-being in China. In this presentation, we'll be covering things like mental health, causes of death in China, health of infants as well, since that is a something that China does have an issue with. I did want to touch on that one as well, and that's the first thing that we will be covering: infant and child health. In the year 2017, 169,000 children died before reaching the age of 5 in China. This is this is sorry a vast improvement over the past over the past 30 to 40 years. As you can see, in 1990, over 1.2 million children died before reaching the age of 5 in China. So the amounts of these infantile deaths have thankfully been going down, and this is maybe partially in part to the elimination of the one child policy, bringing a lot of these deaths to children, since they were really discarded if their parents had already had a child, or if they weren't a boy, since a lot of parents wanted a male child so that uh, they could continue their family name in their bloodline. But as we can see, most of these deaths also are coming within the first 28 days, um, and that with the second most being 29 days to a year, and then 1 to 4 years. Cancer rates in China are another thing that I really wanted to look at, because I know that their air pollution is pretty bad. Lung and bronchial cancers and tracheal cancers as well are the most common types of cancer in China, and this is consistent with the rest of the world. However, China seems to have a much larger distance between these lung, bronchus, and tracheal cancers compared to their second highest uh, contracted cancer, which is stomach cancer. For the rest of the world, it's colon cancer and rectum cancer and then stomach cancer. So this is still also consistent, but the thing that I wanted to point out was that across the world, the deaths per 100 individuals, per 100,000 individuals is 25 per 100,000 for tracheal, bronchus, and lung cancer, and then the next one down is about 50, it's about 14 per 100,000. In China, the rate of lung cancer deaths per 100,000 in 2019 was nearly 40. It was at about 37, 38 per 100,000 compared to the 25 we see in the rest of the world. And then with stomach cancer, it was closer to 24, 25 compared to with stomach cancer we usually see at around 12, 13 deaths per 100,000. Now, colon cancer numbers still about the same. Esophageal cancer is also higher rate in China compared to the rest of the world. This is probably similar to the reasons that stomach cancer and lung cancer are higher in the country with their ridiculously bad air pollution. But this is something that desperately needs to get fixed in China if they want to keep their health if they want to keep their health up and keep their citizens healthy. And mental health is another thing that I really wanted to look at in this, since it's become a more prevalent problem in today's society, with a lot of it really being just noticed now and accurately diagnosed compared to where it was a long time ago. We can see here that the death rates, though, for mental illness or for mental health and substance abuse disorders, um, by by age over time and in general over time, have not really gone up in the world. I mean, 15 to 49 years old have gone up, but the rates for 50 to 69 years old have gone down, and most of the other rates have stayed fairly stable. 70 plus years old has gone up a little bit too, and uh, all ages, of course, gone up a little bit, and then 5 to 14 years old and under 5 years old have stayed fairly flat since there is such a low number of those. But in China, we can see beginning in about 2006 a really big uptick in mental health and substance use disorders deaths in China, especially compared to the rest of the world. Now, in China, they are lower than the rest of the world on average in most of these, in all of them actually, except for one, which is we can see way above there. People that are 70 years old and older die very much more often than anyone younger than them from mental health and substance use disorders in China. And this is somewhat the case for the rest of the world, but the disparity is not nearly this large in the rest of the world. It's a difference of maybe one death per 100,000, whereas in China it's a difference more so of 8 deaths per 100,000 from 50 to 69 to 70. Now, the uptick that I see at 2006 also does cause some alarm for the 5 to 14-year olds, and especially the 15 to 49 years old. Of course, that's a fairly large age group. It's the largest one in this graph, with potentially the exception of 70 plus years old. But we don't see quite the same uptick in the rest of the world as we do here in China. Now, the suicide rates also kind of tie into mental health, and was another thing that I wanted to look at. Now, compared to the rest of the world, China is not suffering uh, all too much from an epidemic of suicide. As we can see, Greenland is the worst country per capita for suicides, and it would really make sense because Greenland's so isolated, cold. That's the type of country that type of thing would happen in a lot. Russia, we also see, has a fairly high amount. Some African countries, and then Uruguay, and the country next to it, I forget the name of. But those also have higher rates than most of the world. In China, the suicide rate has been going down over the years, which is good. It dropped from in 2000 over a little bit over 180,000 deaths annually from suicide or self-harm. It dropped down to a total of 120,000, which is of course still too high, but the numbers are coming down, which is good. They're not currently coming down. It seems like in total they've stayed pretty much the same for the past 5 to 10 years. But um, but here we see the largest number of suicides, um, a, just by a little bit in 15 to 49 years old, and then uh, not really much less in 50 to 69 or in 70 plus. There were 6.8 suicides per 100,000 residents in China in 2019, and compared to the United States, who has 11.67 per 100,000, they have nearly half as much when you take into account the amount of people that we have. I mean, of course, they have more suicides per year than the United States because uh, they also have many, many, many more people than there are in the United States living in their country. So I'm going to focus on how 5G can help solve health and well-being issues in China. I know in the Life Below Water video, I focused on many different technologies because there's not really one that can that can help a ton. But 5G does have a lot of uses. with health and well-being in China. And the first thing I was going to talk about was their response to COVID-19. And while COVID-19 did originate in China, that they did deal with it in a very efficient manner. Um, they had barcodes that people would scan to go places, and they kept a lot of track of their people. It's a very controversial method of solving health and well-being issues, but it did work with COVID numbers dropping in the country. And another way that 5G can really help with health and well-being, I think this is one of the most important, is live streaming and telemedicine in particular, because with a lot of elderly people or people with disabilities, it can be very difficult to get from their house to the doctor's office, um, and it may not really even be safe for them to try and do so. And before COVID 19, telemedicine was a very, um, how do I put it, a very undeveloped industry. And after the COVID 19 pandemic, of course, everyone had to switch to most of their communications going online and being remote. So telemedicine solved this issue and helped a ton. And 5G would help telemedicine be the best that it could be. Um, Live streaming kind of ties into telemedicine, but the way I was thinking of it is also live streaming things like wait times at hospitals or wait times at urgent care facilities or emergency rooms, things like that. All of that can be very useful for people that are trying to decide their best course of action when dealing with a health crisis. And then 5G can also help with various technologies within the health industry. It kind of ties into Internet of Things a little bit, but with increased transmission speeds and reduced latency, which we've already talked about with 5G, a lot of these things can run a lot more smoothly, a lot more efficiently, and potentially save some lives due to the time that is saved.